Good morning. It is Tuesday, September 1st, 2015. Morning of the surgery. Just got off the prayer line and I started my day already. For work, I always start early and I'm a little tired and groggy from the medicine. For the muscle relaxers, had a little bit of back pain and stiffness last night. So between that and feeling groggy and the medicine I'm going to get in a couple hours, should be feeling pretty good. But anyhow, to God be the glory. I'm very peaceful, very rested. Well, not rested, going to bed kind of maybe around 1. I wanted to wake up and stay up to wish my sexy love a happy anniversary, but that shot out later. So my bonnet came from the dollar store because, you know, I was tired of buying bonnets for $5 and my girls were taking my bonnets, talking about they didn't take it, but they took my bonnet. So 3 hours, we'll be leaving out of here. God is good. I'm glad for the prayer line. Thank you, Sister Constance Fleming, for the prayer line each morning. If you can't make the prayer line, it is recorded and you can listen to the playback for it. And, you know, it's just good just to have prayer for everyone, not just yourself, the world, everyone. And people are going through, and I believe there is power in the name of Jesus. There's power in prayer, and I'm a witness of the power of prayer. Because if you don't believe me, look back on my videos and see where I've come. Because I didn't think I would make it. I thought my mind was gone. I thought this was just like... But, you know, that's why the greater is He, God, that's within us. Because if it was on Penny, as much as people might say, you know, you've been through a lot in your life, there comes breaking points. But God. So I thank God for all that He's done in my life. I thank God that as I embark, today is like the first part of the journey with the surgeries to prepare the chemo ports, get the chemo. The chemo update is that they're going to do the consultation and the chemo administration on next Tuesday, the 8th, to allow myself time to heal from today, just in case there's any type of swelling or anything, or I'm not feeling well, because it would have been kind of hard to do the chemo tomorrow, the same time of, you know, trying to feel better. So that's it. So we'll tell you guys, we'll talk to you later on our way later on. I look fab, because right now I have no makeup on. And I gotta look better than this, you know. Talk to you guys later. Love you. Bye. Hey everybody, it's Penny.
It's Tony.
It is September 1st, 2015. We're on our way right now to the hospital to have the surgery. And it is our anniversary, our 9th year anniversary. Love this guy to death. I'm so glad he's with me. And I just want you to see my shirt today, which is family gives me strength, but my faith gives me hope. And I love it. And thank you for all the prayers and for all your prayers. And thank you for everything that you guys have done for us. And it really means a lot to us. And we'll give you updates as we go along.
Thank you. Bye-bye.
So we finally just got registered in. Got all this paperwork here. We're getting ready to go over to the surgical suites right now and get checked in. Tony's over here. Tony nodded out a couple times over there. He nodded out when I was getting registered. Well, that's so cute. So, still feeling good, good spirits. We're ready to get this done. And we'll check in with you soon. Bye, guys.
When you got that iced tea from, that was so good.
Yes, honey. He's so greedy. He's seeing the little market over here. He's greedy. Okay.
All right, this is Antonio. This goes to you.
So I'm journaling all my things I'm doing. So what am I going to do right now? I'm going to go
We're going to go get in the back, get dressed, take all your earrings out, all your jewelry.
Mm-hmm.
You're going to get an IV.
Okay.
And then sign some papers, answer some questions, and then we'll get your hubby back.
Okay. Guys, it was not as dramatic as I thought it was going to be. Going in. So I'll get you guys in a little bit. I'm under all these nice warm pillows. These are not my boobs. I'm under some kind of thing that puffs up, makes me warm, so to get my veins all nice and plump for the surgery. So check with you guys soon. Okay guys, this part, I'm in nuclear medicine and I'm lying on a table. That's why I look crazy like this. And I'm waiting for the radiology doctors to come in. And what they're gonna do is they're going to inject some dye, the blue dye, into my right breast. That's a sentinel node biopsy. So the blue dye is going to be injected either in the tumor site or around the tumor site. And then it travels through the pathway of the lymph. So it's gonna look at all the lymph nodes, lymph vessels and all that stuff, I guess, and it draws this blue picture. So from there, they're able to see and look at the uptake of that. So I'm waiting, and maybe I'll get some good, cool pictures and video of that being done. I don't know though. I don't think I could be in the way, but we'll try. But I'm doing good, I'm hanging in there. And then after that, to the operating room with the fun juice. Maybe I'll get some video of me being fun. Survivor mode. Guys, I'm getting poked.
Squeeze under my hand if you need to. You should be fine.
My boobie. It's a pretty boobie there.
Do you have any questions?
No, I'm ready.
All right. And just to make sure, but is there any chance that you're pregnant or breastfeeding?
No,
Okay.
but I am beautiful. Oh my gosh, looking at myself right now. Pretty.
All right. Are you ready?
Mm-hmm.
Just gonna check your bracelet one last time.
Make sure you're sticking the right person.
Yep. Nice and still. All right. Okay. Are you ready?
Yep.
All right. In the count of 3. 1, 2, 3.
That's it.
Yep. 1, 2, 3.
Oh, you didn't tell me it was more than one time.
Sorry about that.
It's okay.
All right. We're done.
Awesome. He wasn't that bad. He's got a massager, I think, now.
Oh. Thanks for bearing with us. You're doing great.
Yep. So now I'm going to have this massage for about 5 minutes, right? So it can distribute to the lymph.
First picture we take, your arm does have to be over your head. The first picture is 10 minutes long. After that, if you need to take breaks, we definitely can take breaks, and then we just take pictures until it shows up.
Okay.
All right?
All right, guys. See you later. I have to put my arm down. Can you hit this little button? I can't see to move my arm at the same time.
How's that?
Can you hit the stop button for me? I can't. Look
Stop
at my picture. The little square button.
Here?
Square button.
I have to get an addendum system. Here's the antibiotic.
I didn't get no push line.
Are you gonna be in the waiting room?
Yeah, I'm gonna go get something to eat.
Okay. I'll look for when we're all done.
Yeah. I'll be there.
All right. Very good. I'll see you inside there. Okay.
Thank you very much.
So how am I supposed to be feeling relaxed?
Supposed to take the edge off a little bit. It's not supposed to.
Keep it in.
Yeah, I'll take my phone then.
You can take your phone?
Yes, because you're not taking my pictures. This stuff is great.
I told you.
My eyes feel like they're crossing each other.
Time to go.
Time to go.
Time to go. Love you guys. God is good. God, thank you. Lord is my shepherd, I shall not want. He make me lie down green pastures. He leads me beside the still water. He restores my soul for his name's sake. Yea, though I walk through the valley of the shadow of death, I fear no evil. For thou art with me, thy rod, thy staff, they comfort me. Thou preparest a table before me in the presence of my enemy. Thou anointest my head with oil. My cup runneth over. Surely goodness and mercy shall follow me all the days of my life. And I shall dwell in the house of the Lord forever and ever. Amen. I love you guys. Survivor mode. You can do it. I'm feeling great. I'm going to let this go. Okay. Can you move the tube? It hurts some more. But I guess it's not going to ever feel better until this is moved. I appreciate you coming down. Thank you so much.
She said the more you keep moving that tube is gonna keep irritating you. You should just stay in one spot.
Yeah.
Because it's in your chest.
Easier said than done.
My understanding.
See, in my mind, you know, my mind's thinking like, okay, when am I gonna get it done? And,
yeah, but we don't know what was all in the plan of the Lord's work for this not to go forth at this time. There must have been a reason. We don't understand it, but He knows.
No, that's all right.
And I
left side.
What kind of resistance?
Usually the wire passes with ease. And, I wasn't there during that portion of it, but apparently there was some resistance at the time. And Dr. Hernando was a little concerned, so he called the vascular surgeons in to make sure that the anatomy that you have is normal.
right, but it's in the echocardiogram show.
But there's a few more steps before the X-ray.
Okay.
So then we took an X-ray, and you're on. Basically, we do an active X-ray as we place the port, because we want to make sure we can see where the wire goes. That's normal. So we looked at the pictures, and there didn't seem to be too much anything of concern at that point. So we continued with the operation. But then your blood pressure was getting really low, and you were acting like you were bleeding somewhere. Your heart rate was going up, and we didn't know why. So we came in and we got an X-ray, and we got an X-ray of your chest, which showed that you were bleeding, or it looked like it was bleeding in your left lung. So at that point, we actually called the thoracic surgeons in. So there was a group of 3. There was multiple doctors in there, but there was 3 subspecialties in there.
Wow.
Dr. Hernando's group, vascular surgery and thoracic surgery, and we actually placed a chest tube at the time, as you can see and feel now, because it looked as if you were bleeding. Now, differential diagnosis, meaning the possibilities of your lung looking like it's bleeding, meaning it's kind of white colored on the X-ray, there's far, but the worst one is bleeding. And the worst one is something that fills up your cavity and then shifts your heart to the other side, and you can actually get really sick from there. So we placed an emergent chest tube at the time. Now the question at that point...
I'm awake, I'm in pain.
The question, sorry. I just want to, sometimes after anesthesia, you fall asleep.
Yeah, no, it's the pain from the chest.
So at that point, we looked back at the X-ray, we tried to figure this out, and we still didn't know what was going on because your blood pressure was still low. And so we got another X-ray, and we looked very closely at the X-ray, and one of the tube that was placed was actually, and this is the only thing that we could think at this point was causing it, because nothing else seemed to solve it, was that your tube was in one end of your lung and not the other end of your lung, your breathing tube. We don't know how long that was like that. We don't know if that was the cause, but sometimes when you have it like that, your left side can look like it has blood in it or something. So that was a series of events that occurred.
Yeah, because what the doctor told me, he said that it was installed the wrong way.
What the
tube?
Yeah, exactly. So it went the right side instead of being high, so it's breathing both sides.
Now, is that just something that happens, or what?
It happens sometimes. Sometimes you put the tube down, and the anesthesiologist puts the tube down, and sometimes it goes into the right side, and only goes into the right side. That's the most common location it goes. But unfortunately, it wasn't the easiest to hear because her entire chest is prepped, so you can't put a stethoscope on it. So you can't check sometimes exactly this way. And during the operation, sometimes it travels. So it's usually a troubleshoot event that we do. But I think we did everything that we needed to do. I think it's better to make sure that there was no other issues like placing the chest tube than to just leave it to chance that it was just that. So we're doing okay, and everything looks great. We were worried for a minute. Oh, and then the echo. So you were still hypotensive, and we still couldn't figure it out. And we pulled the tube back, so you're now breathing both sides, but it doesn't almost immediately put you back into a normal rhythm. So we put an echo. Sometimes you can have those same symptoms with the blood around your heart. And so we put an echo on to see the blood around your heart, and at that point, for whatever reason, you switched out of an irregular rhythm into a normal rhythm. And your blood pressure and heart rate are fine thereafter.
Yeah, I'm just in pain from the chest tube.
Yeah, it's going to be discomfort. We're going to try to pull it tomorrow morning. Okay? So your job is to take nice big
What about
breaths.
this? Like the sputum? I feel like I'm like, you know, producing like.
Cough it all up. If you can, you know.
And I already have the antibiotic already.
Unfortunately, the port, you know, at that point when you're dealing with an emergency, you want to just maybe even come back another day and do it, or maybe have the vascular surgeon do it, you know, something like that. You know, it's very rare.
The biopsy didn't get done.
But you're okay. I think that's the most important thing. We were worried. We were very worried. There was a lot of us involved. You'll be okay. But we'll figure out a solution to this, okay? Give us a day, you recover, you cough all that stuff up in the meantime. We'll talk again tomorrow. All right?
Thank you so much.
Yeah, you're welcome.
Every time. Thank you.
It's my pleasure.
Can you just wait till I leave?
Hi everybody. I'm out of surgery. I'll give the update. Didn't go as well. Maya's brushing my hair. Brush my hair, Maya.
I'm against this, just so everybody knows. I'm against this whole. She needs to be sleeping and resting.
So am I. We're against this.
Alright. Brush my hair, girls. The girls. Brush my hair.
I can't do it while you're doing
Okay.
that.
So anyway, the nurses make me comfortable. Dilated. Have a chest tube in. I didn't get my other stuff done. Apparently there were some complications in the surgery. Surgical, whatever you call it. Alright, I'm going to sleep. Love you guys. Bye. Ooh.
Okay.
She just gave me the dilated, so it's really down.
You feel short of breath right now?
Always do, but not like panting.
Yeah.
No.
Okay. Any nausea or vomiting?
No, I need to cough.
I'm actually going to have to ask you to cough too, because I need to see if there's a leak in the tube. So whenever you're ready, go ahead. Okay.
See, I thought that feels better, but then when you put pressure on it, does not feel better.
All right. You want to get back in bed, or you want to?
I want to lay down.
You want to lay down? All right, let's try to get you laying down.
Ah, right there.
Yeah, you just gotta be aware of this tube.
The flip. What do I do? Because when the gravity hits, you know, my weight pulling, you know, that's it. That's when.
Well, we'll hold it up.
Should I hold myself together like this, or?
Well, I mean, I'll hold it right here. It's not moving. It's just your body.
Oh gosh.
It's a matter of just getting in bed and getting in a comfortable position. That's gonna, unfortunately, it's gonna hurt.
I can't push past that bit. That may feel like it's gonna break off.
No, nothing's gonna break off. I have everything here and it's taped on.
And it feels like it's.
I know, it feels a little weird, but it's
weird. Oh my gosh.
beyond weird.
I know there ain't a bug on my thing over there. Push past the pain, push past the pain. Push past the pain, push past the pain.
Okay.
No. Baby,
Baby.
be quiet for a minute. Just be quiet. Because I need to go to, I'll get it.
If you
I
can't,
gotta rest into it.
if you can't get into a good position, they'll come in and we'll boost you up. Okay, instead of you moving.
What I probably need is like just a nice wedge to keep it like right.
We can get you a wedge. We can get you something, but we might put that rail in.
Okay.
Okay. Well, let me just. Does that bother you?
And so the pain I feel goes like if your arm were in a sling.
Yeah.
And I found that it's because I had I guess they started to try to do the board.
Right.
So I'm very tender there.
Right.
And then under my arm.
Okay. I'm gonna have to take a look at the chest tube side.
So what do you mean you gotta do?
Does this?
Yeah, but it sits down.
Okay. Do you mind or?
Go ahead. Okay. All right. So, go.
It's gonna be a little lower right here. Oh, actually, we don't have to do that.
All right.
Go right here.
To make sure it's not losing or.
And there is none.
And see, like right here feels okay.
What?
So my arm, like I'm trying to keep it
It's just tugging. When you put your arm down and you move it back up, it's just the tugging.
Oh, okay.
It's just on the skin. It's superficial, but as you move in different
It's
positions,
not inside of me.
it is inside of you. But as you right now, what you're feeling is the tape on your skin. But as you move in different positions, the tube may shift a little bit. It's in the cavity between your skin and your lungs. So it's pushing.
So right now, the chest tube is just only in there as a drainage.
Yes.
Because I'm breathing on my own.
Yeah, you should be.
Yeah, so,
Yeah.
because the chest tube, what's the purpose of the chest tube? Sorry.
The purpose of the chest tube is to keep your lung up.
Okay.
We don't want air getting in between that space and collapsing your lung.
Is that why it feels weird? Like I can't skin over it. Why does the skin feel like,
What do you mean?
I don't know. It feels like it's like fake skin. I guess
I'm not
it feels like, I guess under it must be inflated, so it's so super.
Yeah, I mean
It's not normally like the way this side would feel.
Normally, the layers are connected, and there's a potential space between the two, meaning that it can be created, but typically they're flat against each other. If air gets in between the space, the lungs collapse, and you need to put a chest tube in to suck out all the air, so that the lung can reinflate and stick back up to the surface. And that's what happened. So that's why the chest tube is in right now. I'm going to check to make sure that it doesn't have to be a suction.
What would that mean?
We're just gonna, it's basically pulling the air. It's not gonna feel any different, but it's gonna help re-expand the lungs.
Did the lung collapse in surgery or never collapsed?
Well, it could have possibly collapsed. They did a chest X-ray during the operation, which showed the one side to be completely white, which is an indication that the lung may have came down. Which is something that does happen. It's not like it doesn't happen. It's something that does happen. It happens, not often, but again, it does happen, especially when you're working up here. And they didn't want to proceed further with the procedure because it could have caused even, it could have caused more damage. Yeah, exactly. So,
And he said they saw that from my drop in blood pressure that they thought I was bleeding somewhere.
correct. Yeah.
But they moved all that out.
Right.
And they were like, nope.
Right. So I'll be checking up on you every now and then, to make sure that everything's okay, your blood pressure's fine, your heart rate is also okay, and that this thing is doing its job.
Yeah, it seemed like they were scanning vitals, everything was okay.
Now they're fine. Now they're absolutely fine.
What was my blood pressure that made them concerned?
It was low. I don't know how low, but it was low from your baseline. And then your heart rate also spiked up to compensate, which is an indication that something is bleeding, but everything was ruled out, and right now your vitals, she just took them.
Yeah.
Okay?
Okay.
All right, so I will be annoying you throughout the night, giving you a warning. I'll be coming in and just making sure everything's okay. All right?
Yeah.
Hopefully you can get in a good position.
Yeah, that's the hardest part.
I'll ask her for a wedge. So that
The position is the hardest part. I'm trying to lean into the pain so that way that's my extreme and anything else feels better, but I get too soon.
Right. I understand what you're saying. Okay.
Why did they put a catheter in me? In a way it's good. I won't have to worry about clots and all that stuff, but.
Well, we also want to measure output.
Oh yeah, you can't really see that like that.
Right, and if you go and you pee on the toilet, even if you pee into a hat, we can't measure properly. So that's one reason.
Okay.
So, but other than that.
So when am I gonna get the port put in so I can get the chemo?
We're gonna wait for tonight, make sure everything's okay, and then tomorrow they'll reassess and decide if when and if they want to go in. So you had it on the right side, right?
The breast cancer?
The breast cancer on the right side.
It's still there.
Which is why they want to go to
the left.
The left side. But considering everything that happened, now they have to rethink this and decide whether or not they want to reattempt the left side or try for the right side. So.
Well, how long does it take for it to heal for you to actually do the port on the same side?
Typically, you don't go in for
a second time like
a little while. Yeah, you typically don't go in right away. And if you need this right away, they have to figure it out.
All right.
Okay?
Not for me to figure out.
For tonight, exactly. For tonight, it's a matter of just, getting through the pain.
My biggest issue was infection, and so far, I don't have a fever and everything
You're
else.
fine, and your temperature is okay.
Yeah, I just have pain.
Yeah.
Where that's at.
Right.
And a little bit of, I'm starting to feel a little bit of where they must have started to, I don't know if they did already.
Numb it up?
No, they must have started to try to like, hey, why did you just do
Sorry.
that?
Sorry. I pushed the button.
All right. Yeah. Ow.
You can be at any position.
Ah.
Let me get a stethoscope. I'll listen to your lungs real quick before I head out.
They put it up a little bit more. Oh my gosh. Right there, right there, right there, right there. Oh my goodness. Ooh. I really would be okay if it was this too. Like I can't even explain what it feels like. Like, no matter where you move, I almost want to just lay on it, so that way I can just become. No, that's what I do. I lay on it.
On with it?
Flat.
I'm so scared.
Oh, get off your freaking phone.
People have been messaging me and your mom and dad. Listen, I'm right here.
No, let me show you what you do.
I'm just moving this. I don't want you to sit on this. You can't sit on this.
You can move that.
I'm ready.
I'm trying to get off my. You're a straw man. Look what you're doing.
Oh, you just told me not to do
I want to
anything.
roll towards you.
Okay.
You're gonna lay on it? Don't.
Ow!
Just wait till the doctor gets here. Ask him if that's a good idea.
I don't know what to do. I think I should lay on it.
No. Right now is okay. I mean, there's going to be pain there, and you know, our job is we're not going to take it away completely, but we have to keep it at bay.
I know. I thought it would go away completely.
No.
It doesn't unless you're sedated.
Right, and that's not happening. No.
Oh my gosh.
We just got to keep it.
Alright.
Just got to keep it controlled.
Ow! I mean, every move you make.
Yeah, I know it's going to be painful.
Considering that I'm a severe asthmatic, that was pretty good.
Yeah, I didn't hear wheezing.
Just a little expiratory, that's it.
I didn't hear anything. Okay.
Now, what about if I happen to do it? Because I was, for the pain management from the cancer, I have an autoimmune problem.
Okay.
This sort of period. So I was on, Dr. Barry put me on steroids, 60 milligrams of a high dose. That allowed me to be able to not stiffen. But then will that affect the healing?
I mean, steroids do affect the healing, but this isn't something where I'd be worried about. This isn't abdominal surgery.
Yeah.
You know, where you need a lot.
I just don't want to go backwards when I finally started
right.
being able to be mobile.
No, that should be fine. That should not have any effect on.
I know they gave me some Decathlon and Storage, I'm not sure.
Right.
They probably gave me a little dose.
Right.
For right now, I'm okay, but tomorrow they can at least start it so that I won't
Right. So you won't. Yeah.
get tight again because I don't want to stiffen up.
That's fine. I'll let them know tomorrow that they probably already know, but I'll let them.
And can I eat? I'm starving.
I'll check if they put a diet in. Okay. Well.
No, I don't feel nauseous. I can eat.
Well, maybe depending on what they want to do tomorrow, we may. So that's.
All right, gotta eat before 12.
I don't know if it's gonna work like that. I'll ask.
So I can at least start with the Jello, right?
I'll ask. Let me ask before I say yes. I don't want to make any promises I can't keep. I'm sorry.
I'm over 24 hours down. I'm not
Sorry, I know. I'm
not
sorry.
really.
I'll check on you a little later. Okay.
Okay, thank you.
All right.
Can I do your blood pressure now?
Okay, fine. Yeah, you were trying to catch me at the wrong time.
Oh no, this cough, I can't find it.
Yeah, that you're playing. Yeah, what is that?
I don't know. I'm gonna try it. Maybe this one will fit. I guess.
Okay.
Are you connected to no oxygen? Why are you wearing that stuff on your face? Under your tongue here. Under your tongue.
She good without me now? She doesn't need oxygen?
It's not on her. It's not even connected. It's just in her nose. And her O2 does not need to.
Good. Her volume could be a little bit more higher, but it's good.
Yeah.
That's average. 70 would have been the average.
The thing there go, it went on 92 just now. But it went back down to 89. Let me see if it's gonna go back up.
I wasn't taking deep breaths.
Okay. See, you don't need any oxygen. It's up to 93, 94, and room here.
I used to take deep breaths.
Right.
I'm able to explain.
Okay, see, it's up to 95. So you don't need any oxygen. It's below 90, you need oxygen. All right, I'm gonna come back in one more time to bother you to put a heart monitor on you.
Yeah.
As soon as it comes, okay?
Alright. Alright guys, how you guys doing?
Alright.
I want to send you a link because when Kara came by, there's this new place called Mill Run Apartments in Parsippany. No one knows about it really. And it's done by your income.
Okay.
And you can get like surrogates and surgery.
Okay.
Based on your income. And 2 bedrooms, 4 bedrooms.
Okay. Thank you.
Thank you. When you can.
Red kneecap. What?
Mama?
What's your kneecap?
Do you still want your wedge? You want it?
When do you work tomorrow?
On vacation.
Alright.
Yes, sir.
Oh.
I got a little small vacation because I messed up. I forgot to clean something at work or whatever, and I forgot to stock something. And Ben said, "Alright, I'm giving you like 3 days off and everything this week." So
That's not good.
yeah, that's fine. I did really good on the last day I worked on Sunday, so it's fine.
Yeah, he worked every day last week. Except for.
So what, he just gave you like days out because he think maybe you're tired or something like that?
Probably both. I'm tired and I did mess up on that day, but it's like with closing up, I didn't clean things in the way.
Hmm.
So it's fine.
But you drive or security?
Yeah, of course. Yeah. I was even supposed to work on Monday, like the dishwasher asked me if I had to cover it for him, and I was like, no. I don't feel like working tomorrow. I need days off. I got 73 hours in for the paycheck, so.
That's good.
That's most of that's from this week, from like this past week too, so.
I gotta put me in. I guess there's just nothing.
Just try to focus on relaxing.
I am relaxing. I was doing really good. It hurts. It really, really hurts. I think I'm feeling it like a trooper. The way it hurts. It hurts.
At least your tube isn't isn't that visible this time. Remember last time it was how like it was like right there.
Those are not drains though. This is a drain too, but it is a little bit different.
Hey, come on, or Jared, come on inside. You know, when I sit up more. Move your arm in me. You know.
Make put the side up.
Just no, come lean that in.
You want to slide up?
Yeah. Ooh, you're pushing the button, Jared. Or something was moving.
I wasn't. It doesn't automatically move.
She wants to slide out. You gotta like get.
But I'm not. I don't have my touch that side.
I know you're gonna get the nurse.
You're going right.
I don't know.
You gotta pick this up, or you're about to fall from here. You can't fall from here.
Yeah, I want to.
Don't lean on me.
I'm not leaning on you.
Yeah, you were. Pull up. Pull me up. Tony, pull me
You
up.
just told me not to, and then you told me.
Oh, you know that better? Yeah, pick this side.
Pick this up.
Yeah. I don't think I'll do it tomorrow.